Good morning, good afternoon. My name is Xtavia Bailey. I am the president for Manatee Tiger Bay, and I want to welcome you all today and thank you for joining us. I want you all to make sure that you are relaxed. If you need anything, just raise your hand. I don't know who's going to come, but you're supposed to laugh at that. Would you please stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. You may be seated. This is going to be a reminder to make sure that you turn your cell phones off, please. That would be very appreciative. Today, our topic is about Manatee County versus the pandemic. Everyone that you see here today that is going to be speaking has individual areas that they're going to be speaking about that has impacted Manatee County, how we've gotten through it, what has changed, and what we can do more to move forward. Forward Manatee, they say. So this is what we're doing today. We're going to come and we're going to give information on what you can do and how you can spread the word to make sure that we are always moving forward. So today we have Dr. Jennifer Bency, Health Officer, Manatee County Health Department. We have Susie Bowie, Executive Director of the Manatee Community Foundation. We have Jackie Dalewski, President, Manatee County Chamber of Commerce, and we have Megan Cassidy, broker for Michael Saunders and Company. I will be reading their bios before I introduce them. First, we have Dr. Bency. Dr. Bency has been with the Florida Department of Health for 20 years. She is currently the health officer in Manatee County, where she oversees a staff of 135 and a $10 million budget. From 2004 to 2008, Dr. Bency was the statewide director, Division of Emergency Medical Operations, with 200 staff and $200 million budget in state, federal funds. She coordinated Florida's health and medical preparedness system, as well as the state's trauma centers and EMS. Dr. Bency has also served in leadership roles in health departments in Orange, Seminole, Miami-Dade, and Bay counties. In addition, Dr. Bency is a professor of public health at Everglades University and a former professor at the Florida State University's College of Medicine and University of Central Florida. Please give Dr. Bency a round of applause as she comes and speaks today. Thank you.
Good afternoon. Thank you so much. Hello, everyone. Thank you for being here today. I know it's been almost 2 years that we've been dealing with the pandemic, so I appreciate your interest in wanting to know the latest as we hopefully move out of the pandemic. I want to give you first a few statistics on where we are, and then just a little bit of background on what's been happening and where we are now. So the case rate in the county is 2.5%. That's great. We want to be below 5, so hopefully that'll remain there. We have over 66,500 cases in the county, and 52% of those were Delta variant cases. Unfortunately, we have recorded, as of this week, 1,230 deaths of our residents to COVID. And almost 80% of the population has been tested at least once for COVID in the county. The median age of all of our cases has dropped to 38 years of age, and the percent of residents vaccinated age 5 and above in the county is 64% currently. That's at least one dose. For those 5 to 11, we've already vaccinated 3.5%, and for those 12 to 19, 48% have at least one dose. So what happened when we first heard about COVID way back in the end of 2019? Well, we at the health department with our partners stood up an incident management team at the health department, similar to what we do during hurricanes, any type of disasters, right? So it's a military response to an event. For those who are familiar with this, FLOP is the acronym. So you focus on finance, logistics, operations, and planning. So my team, those who were carved out to assist with COVID, started assisting in these specific areas. So our budget, you heard from Xtavia, is now doubled what it was. And our staff has doubled as well in the last 2 years due to COVID. We've received a lot of funding, federal, state, local, and I want to thank the county because they did give us $2 million of their CARES funding for COVID. Logistics, really important, right? Ordering and distributing all of the millions of supplies that we all used in the community. So that's gloves, gowns, masks, computers, staffing contracts. We alone bought $250,000 worth of the Q tests, which were the PCR rapid test that we used at John Marble to get the children back in school. So those were really, really useful, and we just closed down that on last Wednesday because the need was no longer there. In terms of operations, that's the big area. So we focused on really 6 priorities: infection control, community testing, staff preservation, my team, so we could keep moving forward, surveillance, mass vaccinations, and vaccine hesitancy grants. So the first thing was the infection control. So this is when we put in a mission request to the state, and on Easter morning of 2020, 8 nurses from around the country arrived at our health department, and they have been here ever since. Thank goodness Bob Evans was open for carryout that day. We did have a nice meal at the end of the day, but their responsibility continues to be going to the long-term care facilities, monitoring outbreaks, trying to do infection control so that we don't have any more outbreaks. And this also is at other locations such as the jail, the port, places where people are in confined locations and outbreaks have occurred. The next is testing. So my team, I'm proud to say, led the efforts originally for the walk-up and the drive-through testing. We started, remember, at the convention center, and then turning points, mobile home parks, migrant farms, detention centers, and we also do a lot of rapid testing now as well still for the first responders. In terms of prevention, obviously we set up a screening process in our building for our staff and visitors, masks and sanitizing mats, the whole 9 yards to keep people safe, because our health department was still open for other operations. We also gave out millions, literally, of masks in the community. I want to thank Jackie and the Chamber for leading that charge with us and getting those out to the businesses. And also, we also worked with our surveillance number 4, which was the epidemiology. That's the core of public health, right? So surveillance, contact tracing, each one of those 66,000 plus individuals who tested positive were contacted by my team to do the information gathering for determining isolation, quarantine, and reaching out to those who were potentially exposed. We also had a team at the school district, the District Operations Center, or the DOC, making sure that we were working with all the principals every day, determining who needed to go home early on, particularly when this was in the last school year. So also we then went to vaccinations, and I can't say enough, I'm so proud of our community. The governor even came to see our efforts. We set up the drive-through vaccination sites. We gave over 185,000 vaccines during the time we were there from December to May, and we also were at the Public Safety Building, if you remember. So just really a great model of bringing people together. We also worked with the EMS, community paramedics, to make sure everybody who was in their homes could get the vaccines through them. And also have done a lot of testing now and combination vaccine sites with our many partners. We are proud to say opening a site near the airport, actually the runway in the Manatee County side of the line, if you will, and that'll be our home for the next 5 years there in the South County. We'll have a permanent presence there, and obviously we'll start doing vaccines for children and adults, including those booster shots, hopefully by next week. We were also one of 3 health departments to be awarded a vaccine hesitancy coordinator through the National Association of Health Departments. And so she has done a tremendous job of reaching out into communities to find out what the issues are related to vaccine hesitancy and how we can help educate and provide information for future decisions. Finally, the P is planning, right? And all of the above activities could not have been accomplished without the it seems like millions of virtual calls that we had with our many partners over the last 2 years. And I'm going to shout out to, the county, the hospitals, the medical society, MCR, Centerstone, right? The impact of mental health on all of us, but particularly our children during this once-in-a-century event. The Multicultural Health Institute, all the others that really came together to make a difference. And then also other responsibilities in an IMT or incident management team is communications and messaging, interviews, presentations. Thank you, Susie. The Community Foundation has really led that charge here. Radio spots, billboards, and of course we had the famous Mask Up and Vax Up Manatee campaigns, again, models for the rest of the state and country, working with all of our partners, Healthy Teens, Unidos Now, making sure multiple languages were being addressed to get the messages and word out to everyone. There's also a safety team going to every site before we set up, and during that to assure that our staff and our clients are safe during their entire visit. And we learned a lot with drive-thrus, right? People in cars, the difference between the brake and the pedal. So that was a little bit of a challenge there behind the scenes. And finally, my role as a policy lead, working with state and local officials on decision-making and implementation. And I really want to just take a minute to thank my staff, again, keeping the health department doors open throughout the pandemic and still providing all of our other services like WIC, Women, Infants, and Children's Program, all of our clinic operations, and our environmental health, just to name a few. And I'll stop there. Thank you.
Thank you so much, Dr. Bensi, and your charge and what you've done in Manatee County to ensure that our citizens are not only aware of their options, because we know everyone has an option to put on the mask, everyone has an option to be vaccinated, but it is our job here in our area when you're in these positions to make people aware of their options. Please give her another round of applause as she's finished. Thank you so much. Next, we have Susie Bowie, the Executive Director of the Manatee Community Foundation. Susie Bowie has worked in philanthropy for 16 years and is the Executive Director of the Manatee Community Foundation. She leads her team in working with donors, nonprofits, and leaders to strengthen and enhance the community through philanthropy, education, and service. The foundation has grown prior to her leadership role at MCF. Bowie was the Vice President of Philanthropic Education and Marketing at the Community Foundation of Sarasota County, where she worked in various roles for 11 years and spearheaded the launch of the Giving Partner and the Giving Challenge. And if you are a nonprofit, you know that was a blessing. Two initiatives that sparked and formed charitable giving in this region. Please give her a round of applause as she comes forth and tells us the impact with philanthropy.
Thank you, Extadia, and thank you for your leadership. I want to thank Dr. Bensi once again. In addition to all the things that Dr. Bensi rattled off, she and her team are one of the reasons we were all able to sleep well at night, so thank you. So listen, I want to put my comments into three different categories. The impact of the pandemic on nonprofits, the impact of the pandemic on donors, foundations, people who give, and then some of the pressing issues that we're looking at in the charitable sector. I want to start out by saying that in December of 2020, Florida Trend named nonprofits the Floridian of the Year. And that is evidence of the huge role that nonprofits take on in our community. So I see some of my nonprofit friends in the audience. If you work for a nonprofit, can you please stand up so that we can recognize you? Thank you. Thank you so much for your leadership. Here's really the golden nugget for me about the pandemic. It forced people who want to help our communities into a better appreciation for the systems and the interwoven circumstances that cause some people to be more vulnerable in terms of their health, their economic and educational issues that impact them. So it forced us into that greater understanding of the systems, and I think that's really important. So let's look at nonprofits. The pandemic really showed that many nonprofits are nimble, they're flexible, they're responsive in their delivery of services. But the need for more technical devices, the need for more technical proficiency was shown in a huge way. These technical devices, not only for the staff that worked at nonprofits, but for their clients. So there were major, major investments that had to be made in this space. Gonna give a couple of examples. The Women's Resource Center was an amazing example. They got their entire office up virtually within 4 days after everyone had to go home. They were providing services to all of the women they served within 4 days. These were some changes that they were hoping to make in the long term. They made them very quickly. Still today, you can get a weekly newsletter from the Women's Resource Center that provides all of the updated information that we need to provide support for people who are vulnerable. So they were incredible. Easter Seals of Southwest Florida that provide services to people with disabilities. They were able to even provide virtual therapies to their clients. They never closed down for one day. They kept moving forward. So these are incredible examples of innovation in the nonprofit sector. So as we've discussed, the model for program delivery was greatly changed. Really for non-programmatic teams, but for a lot of people, they had to continue going in if they were serving people. And this caused us to reflect very deeply on our use of volunteers. Many of the organizations that distributed food, for example, relied on older, vulnerable populations that were volunteering to distribute that food. As you can imagine, they didn't feel great about distributing that food because they had to protect their own health. So some of those organizations had to really scale back in what they were able to provide. Other organizations provided even wider reach outside of Manatee and Sarasota counties. The Neuro Foundation, for example, providing support to people with Parkinson's disease. They now have a national audience for many of their regular programs because of their virtual support, bringing attention to the great work and leadership we have coming right out of Manatee and Sarasota County. Foster care. I think many of you know what an issue foster care is in our community. Manatee County still has one of the highest child removal rates of any county in the state of Florida. And one of our ongoing problems has been we don't have enough foster families. But throughout the pandemic, because we were not able to get together and do the trainings for new foster families, we were able to do those online. And we found that more people came into the space to be trained as foster families. So that was one of the benefits of this kind of digitized environment. Finally, many nonprofits discovered that donors, while they may be looking for social interaction at events, what they really wanted was to support the missions that were most important to them. So we talked to many organizations that actually raised more money in the pandemic than they did outside of the pandemic. In many cases, their virtual events pulled in more funding. They tended to be a little bit more mission focused. Think about it, if you're working virtually with someone on an hour, right, it forced many of us to be video producers. But it was focused on the mission, so they were able to bring in more money. And we really learned that CARES was an amazing support. CARES funding supported about 75% of the nonprofits that answered a survey we sent out for Sarasota and Manatee County, so that was a huge support. I want to talk briefly about the transformation of donors and foundations. I think more often than not, the pandemic helped us understand the need to give general operating support to the nonprofits we trust. Things were changing so quickly, so you could put money out there for a very niche need, and you could find out that 2 weeks later it wasn't needed because government funds had come to fulfill that need. So I think it's shown us all a very powerful lesson. We need to find the nonprofits we trust, and to the extent we can, give them general operating support. Trusting the nonprofits as the experts. I know a lot of our friends in the business community want to come in and talk to the nonprofits of how they can run their nonprofit like a business. Well, we do, but we are also subject matter experts and taking care of kids and taking care of animals, doing the work we need to help our population. So trusting nonprofits as experts. taking greater risks with grassroots organizations and some of the organizations that are led by people of color that we may have not given the right amount of funding to in the past. This is really important. They're trusted by their communities. They're doing the work that's getting the gains for people. So we've been taking a long, hard look at that at the Community Foundation. Equitable recovery is really important. As I mentioned to begin with, there are under-resourced groups of people that have always been struggling, and it's time to help them with more resources. They know how to make their communities better. They just need the resources to do it, and now is the right time to do that. So now let's get into a few of the issues that we're really paying close attention to, and I'm sure they won't be surprising to you, but in the social sector, housing is one of the #1 issues. We're facing a huge eviction crisis here, and this is not just for people that live really far below the poverty line, but it's for working class people. It's a huge issue with housing in our community. Wages have not kept up with the cost of rent and mortgages. Again, not only for the most vulnerable people, but for all of us. Digital access and inclusion is huge. This means having access to devices. It means having access to broadband service. And it means knowing how to use those devices. As we've discovered now more than any other time, if you don't have those 3 things, you cannot look for a job. You cannot access healthcare information. You cannot do your homework, right? You cannot find the resources you need to be actively engaged as a citizen. Mental health. Dr. Bensey talked about mental health. We have never before seen the amount of requests to support mental health as we have today for adults, for teens, and for children. Okay, we're getting these requests from organizations like Take Stock in Children, where they have mentors working directly with students who have said, I've had so much anxiety and depression, I can't go to school. We're not able to pull enough money into our household, and I'm having to get a job, a second job, whatever, to help my family. I need help. It has become paralyzing for many people. And also because of the greater social isolation that people faced during the pandemic, that exacerbated a lot of mental health concerns. And finally, I want to point out arts organizations. A lot of people haven't been talking about arts organizations during the pandemic. Our focus has been on health and human services, but we need our arts organizations for the vitality of the economy. We need them. Looking at Manatee Performing Arts Organization as an example, they were out there hosting movies and hosting celebrations and hosting plays in their parking lot just to bring people together socially. We've got to have these arts organizations, and we have to celebrate them, not only for the joint human experiences we enjoy, but for our economy. So those are a few of the things we're paying closest attention to. I want to thank everyone here who's given to a nonprofit, who serves on the board of a nonprofit organization, or who's helping our community move forward through this. Thanks for inviting me, Octavia.
Thank you so much, Susie. Please give her another round of applause. That was some great information. We have so many nonprofits in Manatee County. I sit on the board where we fund almost 60 nonprofits that deal with children every single year. And our nonprofits really, really stepped up to the plate. They adjusted. They did things that they never did before. It was scary, but they did it because they had to, and they're the leaders in our community. They're the true leaders that really are doing and adapting, and they had to really do what they had to do. And those ones that are working with the children, they made sure our children were okay. So I thank all the nonprofits because I know it wasn't easy. And again, Susie, thank you for your presentation. Next, we have Megan Cassidy. Megan Cassidy is a 19-year veteran of real estate industry who has held positions in real estate management, strategic development, and consulting. In these roles, she maintained the perspective that the most important goal of real estate manager should be the coaching and guidance they bring to their team. Megan's strength is real estate management, is the ability to fine-tune a coaching program and business plan around the specific growth plans of each agent, whether branching out into a new market or price range, making a leap into production, or building new business as a new agent. Megan works with each sales associate to curate an approach that leads to greater success. Please welcome Megan Cassidy, broker with Michael Saunders.
Thank you, Xtavia. I am so honored to be here to speak with you all, and I'm so honored to be part of this really amazing panel of women. So thank you very, very much for inviting me to speak. So real estate and how it was affected by the pandemic. This is a really hot topic, and I'll try to keep my remarks as concise as possible as we go through what happened in real estate. So I'm going to take us back to April of 2020. And the pandemic has required that and necessitated that these businesses shut down. What happens in real estate is that at any given time in any given market, 7% of the population must move. They either must sell or they must purchase a home for those reasons. And so because real estate had been deemed an essential service, the very first impact that we had in real estate from the pandemic was the fact that we had to change how we ran our real estate business, not only as real estate agents, but as an MLS, as title agents, as mortgage brokers. What we had to do is take the technology that existed out there and use it for real estate in a way that it hadn't been used before. So in April, what we had is we had buyers that were desperate to sell. They were afraid to travel. They were afraid to go into the houses. We had sellers who needed to sell, and they were afraid to let people in. What the MLSs allowed us to do was to start a process called virtual showings that counted to keep the property live in the MLS. They changed their rules for that. The real estate agents had to become extremely versed and well-versed at using video, being able to explain enough about the property and the community to make sure that the buyer felt comfortable purchasing that home sight unseen. After that, we had to use and exercise the use of digital signatures in the documents, and then our closings very often took place in the parking lots of real estate agencies, title companies, with the individuals purchasing or selling, signing the documents in their car, and the notary standing outside the car and notarizing those documents outside the car. These practices actually still exist today. We still see a need to make sure that everyone is protected and kept as safe as it can through the real estate process. So that impact was the very first impact that we saw on the real estate market. The second thing that had changed in real estate is a big change because we had been operating in the industry in a buyer's market. We'd been operating since 2007 as a logical market. And what happened immediately was that people started to make decisions that were based more on emotion. So if we go back to 2007, we have a millennial group that's young at that point. They see all of the stress that the housing recession is putting on their parents. And as a group, they were slow to purchase. Since 2013, this group has been kind of sitting on the sidelines and not deciding whether or not they wanted to purchase a home. When the pandemic hit and we went into a lockdown, what happened is it changed the way that people work and it changed the way that children go to school. There were many instances where people were trying to do 2 jobs out of 1 apartment. They were trying to homeschool their children. And so you began to see a shift nationally with individuals moving from an urban area to a suburban area or from a suburban rental into a suburban home. And that movement of that millennial buyer, who, by the way, the oldest is now 40 years old, if you can believe that. But that millennial buyer, when they started to move, started to recapture the strength that they have as a buying group. The next thing that happened is the Gen X generational group took a look at the real estate market and decided that maybe this is now the time to purchase a second home. So another driver that happened in the real estate market was the purchase of second homes by individuals who could work in a different location, who could school their children in a different location, or who wanted their parents to have some place safe where they could live, and if they wanted to, they could go outside in a beautiful area. The third thing that happened is that people began to make life choices. Do they want to be closer to their grandchildren? Do they want to live somewhere where they've always wanted to live? And so as a result of this emotion in the real estate market, What you saw nationally was you saw this immense change with people moving from different states. You saw the change from the city to the suburbs. And what you saw is a great deal of real estate transactions going on. How this impacted Florida is Florida, for many individuals, is an aspirational state. And it's aspirational for many reasons. It's a tax-friendly state. It's a state where you have beautiful scenery. It's a state where you can do a lot of stuff year-round. The big benefit to many people is that this is a chance for them to reset their life, give more to the community, be more involved overall. And a lot of people started to make that decision. If you look at the states that were impacted most positively from all of the movement in the real estate industry, it was Texas and it was Florida. So those two states ended up with the most movement overall. So now, how did this impact Manatee County? And I'm going to talk about supply and demand. But I'm going to use a really good analogy. So, supply and demand. Imagine that you are trying to fill a bathtub with water. The water that comes from the faucet are new listings. The water that's in the tub is inventory. At the bottom of the tub, there's a drain. And depending on how big or small that drain is, the water is either going to drain very slowly or drain very quickly. So the drain represents our buyers. And we had such tremendous demand in this market that our inventory levels or our water level in the bathtub diminished. So we were taking on listings at the same pace, maybe a little bit faster, but our pending inventory, our buyer demand was such that inventory dropped significantly. In Manatee County, single-family home inventory in 2019 and prior to that was ranging right around 1,450 units at any given time. Buyers had a lot of choices. Last year, when people decided that they weren't ready to sell or they weren't necessarily ready to buy, our inventory dropped to 773 units. Currently, we are at 414 units. Now, 414 single-family units in Manatee County is really low, and what happens as a result of this is what pushes our prices up. The average home sale price in Manatee County for a single-family home rose 29% over the last 12 months and 44% over the prior 12 months. So obviously what this means is that we move forward, there are a couple of things that we need to do to make sure that our real estate industry is able to make sure that the people who need to buy a house can buy a house. We clearly need more inventory, but we need some place for our sellers to go. We might be able to increase that inventory. Let me be more positive about that. With the borders opening up, I think that the international seller will come back, they'll spend a little bit of time here and then probably put their home on the market. You'll begin to see other sellers be ready to sell their home because their new construction is complete. You'll be able to see that as the new construction gets caught up, our inventory levels will stabilize. We are seeing some increase in inventory right now, but it still has quite a ways to go. For our first-time home buyers and for our individuals who really need to find a house, the answer is you can find a house. This is still an okay time for a first-time home buyer to buy. You just have to stay focused, and you have to be consistently working towards it. We've kept our first-time home buyers focused, and in most cases, they've ended up in a house that works for them. So the inventory is out there. That 29% price increase that I'm talking about, that's across the board. In each price ranges, that may have increased a little bit less or a little bit more, depending on type of property that was available. The most positive thing that I can say at the end of the day is that we're in a location for many reasons. Part of the reason is because of fabulous people like you that are sitting in this room. The second is because of the opportunities that they're offered here. Our commitment is to make sure that people in this community have a home to live in, and we'll continue working that way. We see nothing but good coming in the future, and I want you to all know that you should feel positive about it. Thank you very much.
Thank you so much, Megan, for that information. I like that analogy, the bathtub. Please give her another round of applause. On the other side of that, we have to remember the Alice report that comes out, because those are the people that remember they're working, but they may have transportation issues. They may be working every single day and they can't buy that house. So that's another thing that I think we're going to be faced with as we look down the road, as we recover from the pandemic. But next, we have our last panelist, Jackie Dalewski. Jackie Dalewski leads the Manatee Chamber of Commerce as president and CEO. She began her career with the Chamber in 1996 and quickly fell in love with its mission and impact. Prior positions with the Chamber had Jackie leading initiatives on workforce development, communications, healthcare, leadership development, and young professionals, among others. The Manatee Chamber is accredited at the 5-star level nationally, which is a distinction earned by less than 1% of the chambers across the U.S. The organization is a past National Chamber of the Year Award winner and a 4-time Florida Chamber of the Year Award honoree. Please welcome Jackie Dalewski, our president of the Manatee County Chamber.
Thank you so much, and thanks to the expertise and fantastic presentations of our other panelists. I hopefully will bring us in for a landing that allows some time for Q&A, because that's the beauty of Tiger Bay. So it's interesting that the 3 words I wrote on my note cards in preparing some comments to share with you all today that hopefully open some additional dialogue were resiliency, adaptability, and compassion. And I think about what Dr. Bensey and Susie and Megan have shared really hit home on all 3 of those themes that I have seen in working with more than 2,000 businesses and small employers in our community. You know, knowing that so many businesses, like we heard real estate, like we heard the health department, like we heard nonprofits and philanthropy, was pivoting on a dime, right? In those early months of the pandemic, when there was so much uncertainty and so much concern and really fear for a lot of us about health, fear about our economic well-being and those of our teams when you talk about business owners, and new business models were launched overnight. Some of the things that I believe were the most impressive in those early days of the pandemic, and I've shared it in other top opportunities I've had to speak on behalf of the business community, we're thinking about the restaurants and the retail who literally overnight found ways to use technology that they had not yet implemented prior to this in their business to have online ordering or to have delivery in the face of concerns and changing customer needs with relation to accessing products and services. It was so impressive. You know, Susie mentions the adaptations that nonprofits had to do early on related to technology. You know, the Chamber, a more than 130-year-old organization, exceeding most benchmarks that are placed on our industry across the country, most of our computers were desktop computers prior to the pandemic, and thanks to phenomenal philanthropy and support and our own financial planning long-term, you know, we had to secure laptops within days, just like every student in any school system across the country had to. You know, we were all competing for the same resources, but we all worked together to overcome those. You know, PPP, ERTC, that alphabet soup of assistance programs that were available early on. What struck me was the important role that our chamber was able to play in being a very clear and concise and timely communicator, right? People wanted information, they needed it to be accurate, and they needed to connect to resources that were brand new, and really, in many cases, organizations, our local governments, state and federal governments, were building the airplane as they were flying it when you think about these assistance programs. To give you a couple of statistics to think about the resources that we were able to bring collectively as a community to businesses in Manatee County, particularly through CARES Act dollars, thanks to Manatee County government's tremendous leadership and effort. There were 1,336 grants that came to small businesses in Manatee County thanks to the dollars that that the county was able to draw down. That was more than a $20 million investment through grants to local small businesses to help them with their recovery from the impacts of COVID. Housing, we've talked about that. Susie mentioned the concern related to evictions. So far, Manatee County has been able to assist 413 families stay in their housing thanks to the Emergency Rental Assistance Program. That was more than, I think it's about $1.9 million that thankfully flowed to landlords who also are small business owners when you think about how they're using their real estate investment as a small business. But there is big need still looming out there. So one message, maybe somewhat off topic for me, if you know a family that is struggling to pay their rent, there is assistance available still. And it's assistance that can help in the future as well as make amends for back rent. There are navigators, thanks to tremendous support from philanthropy and from government. There are live human beings, imagine that, that are able to really walk a tenant through the process to try to draw down those dollars for rental assistance. They have hours at the Palmetto Library, at the Manatee County Public Library, at Mount Carmel Center, as well as at the Gulf Coast Legal Services. So if you need that information, please don't hesitate to call the chamber, because we want to get those dollars out into our community to make landlords whole and to keep families in their housing. We surveyed our membership in September in preparation for a leadership retreat for our chamber board and wanting to understand where they were in the recovery, as well as what they were projecting for the future. So this data is just a couple of months old. We had more than 600 local businesses and employers that responded to the survey. And there was a lot of good news and optimism that businesses are feeling at this point now, thinking about the fall of 2021. 78% of the businesses that responded to the survey expect moderate or strong growth in the local economy in the coming year. So I think we all have sensed that. The recovery here in our state, as well as in our community, in many cases is well ahead other major regions across the country. 46% feel that they are either fully or close to fully recovered from the economic impacts of COVID. So almost half of businesses said that, you know, they are doing just fine at this point, thanks to adaptations and support and their own business strategies. 32% felt that they're still working towards a full recovery, but that they're doing okay. But 18% feels that it is still difficult to feel or access the ability to fully recover for COVID. So while it feels like the economy is humming along, that most businesses are doing well, many are trying to hire, are looking at growth projections, there's still close to 1 in 5 businesses in Manatee County, at least as far as September was concerned, that still have not found a way to feel truly comfortable with their recovery. 56% of our business respondents are looking to expand their workforce in the coming year. So no surprise, we've all read the headlines, we've experienced ourselves in our organizations or hearing from family and friends. Workforce is a challenge right now. Some of that driven by the pandemic, but some of it not driven by the pandemic. Some of this is our workforce pressures that we have felt for years, if not decades, as we look at how we prepare a workforce that can meet not only the needs of businesses today, but the future careers that we don't even know about that are coming down the pipeline. Our unemployment rate for our MSA, which is Northport, Bradenton, Sarasota MSA, has dropped below 4%. So you think about, just take COVID off the table, a less than 4% unemployment rate typically means that everyone that's working, that wants to work is working, and businesses are having a challenge finding talent, and we know that that challenge exists. To give you a little bit of perspective, I looked at some U.S. Bureau of Labor Statistics data to say, you know, where were we in some other years with regards to unemployment, even, you know, without the challenges of a pandemic. Over the course of 2012, just to give you some perspective, the 12-month average unemployment rate in 2012 was 8.5%, 2013, 7.1%. So you think it was not that long ago that we had double the unemployment, but our challenges feel really, really strong right now with regards to that. We've added 16,000 jobs year over year in Manatee County over the past year. To close off, a couple of other thoughts for you that I think are very optimistic and point to opportunity and opportunities to meet challenges together as a community. Florida is the 15th largest economy in the world if Florida was a country. So the economic output of Florida as a state surpasses that of the country of Mexico. So when you think about economic opportunity and what we have working in our favor in the state of Florida, that list is long. Florida created 1 in every 11 jobs that was created in the United States from 2015 to 2020. So there is huge potential for us to seize opportunity and make sure that we've got an economy and policies that support an economy for all of us. That same survey I referenced with regards to optimism and thoughts about recovery, we also asked them to identify what their biggest challenges were and what they felt the biggest challenges were for the community. So I'll close in that maybe as a challenge for all of us to think about what we have to be thankful for as we go into the holiday season and what we should have on our plates and our radar for the coming year. No surprise, probably this list of local business challenges. The most responses came in the areas of staffing and hiring, lack of affordable workforce, or lack of affordable housing, lack of access for small businesses to provide health insurance to their employees. There are still significant barriers, and business owners want to do it. It is just financially out of their reach. The changing dynamics of COVID and some uncertainty with regards to what the expectations are of their workforce or their customers, and then the changing dynamics of how they're interacting with their customers. The biggest community challenges that businesses shared with us were related to the mental health of their workforce as well as their families and their friends, the affordability of housing and how that's impacting the availability of a qualified workforce, traffic and infrastructure, and then one that was mentioned quite often was the need for us to continue to find more ways to come together, to find the things that we agree on and prioritize together. Is that my 6 minutes? I'm almost done. I did not come in under as I was hoping to. And then I would just share with you, we celebrated the 41st Annual Small Business of the Year Awards just less than 2 days ago at this point. And I want to tell you this community responded by nominating more than 230 small businesses and nonprofits. And as we were sharing the stories of the 7 winners that were honored on Tuesday, this idea of resiliency and compassion, adaptability, and caring about their workforce as a family ran through every narrative, and I could not be more proud of local businesses in our area for what they have overcome and what they have protected for all of us as with regards to the local economy in the past 2 years. Thank you.
I really didn't plan to have all women on the panel, but you super women, you guys, you all rock. You all rock. Thank you so much. Now, this is going to be our last meeting for the year, so if you need to go ahead and get your renewals for membership, please do that. Raise your hand, Tanya. She's right over there, because we will start in January, and we are going to be ready for 2022. And we are going to come ready with great topics. Remember, next year it's going to be a legislation of new electees, or people trying to get elected at least. And so, yes, you will see our debates. We will team up, and we will bring that information to you so you can make the best decision. Does anyone have any questions today? I'm going to be nice. Come up. Anyone can ask the question. You don't have to be a member today. Wow. Look at me. It must be the red. It's the holidays. Yes, Miss Valerie.
Hello, I'm Valerie Vale.
Step up to the mic, baby.
I'm Valerie Vale. I'm a board member of Tiger Bay. I have 2 questions, one for Dr. Bensey. The nurses that you said have been here for 2 years, will they become permanent employees, or there will be an end game for them? And Megan, how much faith do you put in Zillow and there's another one? So those are my questions.
Dr. Bensey and then Megan. Go ahead.
Thank you for that question, Valerie. So the contracts are with a state company, so we will probably be ending those, but we offer job opportunities if they want to work full-time for us. Some choose to go home, some choose to stay. And then we're also looking at some local contracts for some of the other nurses in our programs that exist every day because there's such a shortage of healthcare workers.
I thank you for the easy question. So the Zillow algorithm means that they have enough data to give to guesstimate a value of a home. And so all of the things that can happen in a home, where it's located, what's the view, what's the exposure, the age of the roof, they're guessing for the most part to make sure, and they're averaging it out across a community. So sometimes the algorithm has enough data to pull from where it's exactly right, and sometimes it's not right just because there are more factors at play there and they don't have enough information to weigh it on.
Is Realtor.com similar?
Yes. So all algorithms are going to be the same way. Even our MLS, when we run information in the MLS, we still, and it takes me 3 hours to do a CMA with an agent because you look at everything. You look at all of the finishes in the home, the age of the home, where it's located. Everything has bearing on the value of the home. So we try to make it easy, but thank you.
Valerie, she's my broker, so if you're thinking about selling your house, you could just see me afterwards, okay? Come up.
Hi, my name is Jane Filesticker, and I'm a member. My question is mostly for Dr. Bensey. I'm a microbiologist with a specialty in viral genetics, and I serve on the Manatee County Healthcare Advisory Committee. And we were functionally disbanded just after the beginning of the pandemic. And I'm a little bit confused as to why that happened. We had transitioned to meeting on Zoom, and we had continued to advise the county commissioners on the ongoing pandemic situation. And of course, in my field, I have kept my nose right there in all the literature all along, and I had a lot to say. So did the other medical advisors.
She's saying it too.
So did the other advisors on this committee. So my question is, I'm not sure that you have the answer, but I was wondering how quickly we can reconvene that committee, because we all still have a lot of input that we would like to put towards policies pertaining to pandemic recovery.
Thank you for that question, and that brings me to something that I didn't mention earlier. So we are Department of Health. We're actually state employees. We are not county employees, and I know that advisory committee came through the county, and for any of us that receive funding from the county, we could not be engaged in that process. So I know now Dr. Josh Barnett, he recently received his PhD, was the one leading that team, and unfortunately he left, and I believe also Pascal left. So they're restructuring at the county, and I believe EMS Chief Jimmy Crutchfield now has lead on the health entities at the county government level. So he would probably be the best one to talk to, since I agree with you completely, an extremely important voice for the health of the community.
Hi, I'm Liv Coleman, and I have another question for Dr. Bensey. I'm a professor at the University of Tampa in political science. I live in Manatee County, and we have a lot of students right now who are out with the flu. And so I was wondering how you're dealing with, amidst the pandemic, how you're dealing with the flu. What is the flu vaccine rate like? Are people actually going and getting the flu vaccine? And then actually another question too, during the pandemic, there was a news story just the other day too, that there were, for the first time last year, there were over 100,000 deaths to drug overdose nationwide. And I know this has been a very serious issue in Manatee County with the opioid epidemic, and dealing with that at the same time as the pandemic. I was wondering, how does the health department manage these challenges? Thanks.
Excellent questions, thank you. So yes, we were very fortunate last year that we had very little flu in the country, no pediatric deaths in the state. That's something we monitor. We don't monitor cases of flu. We do surveillance monitoring with a few physicians in the community, but very little. Was it because we were socially distancing, we were wearing masks, we were hand washing more? We don't know, but yes, we are starting to see it again around the state, around the country. I don't know if you've seen the University of Michigan has a tremendous flu outbreak going on. CDC's on the ground there. So yes, we are concerned because every season it's different in terms of the strain, and we want to make sure people stay vigilant. So we, yes, are offering it. Everyone in the community, the retailers are offering it. We're encouraging people, you can get your flu and your COVID shots at the same time, but please do get them because we are very concerned, absolutely. And I'm sorry, remind me your second question. Oh, yes, of course. Well, again, working together with all the community partners, Drug Free Manatee just sent out an email this morning asking that the task force regroup and start meeting again routinely because it has been a tremendous issue in our communities way back years with the fentanyl and then still moving forward. We're putting a lot of effort into mental health first aid and assisting through Centerstone and other partners, but we're concerned because this and many other diseases like cancers and other priorities in our lives have been put on hold for the last 2 years. So what are we going to see? And that's why our Manatee Healthcare Alliance is so important to be able to continue to do the community health assessments and the community health improvement plans and working on these committees. And I know we have a committee specifically devoted to this. We have a lot of groups working together. We have some national grants through the CDC, the OD2A grant, but yes, all hands on deck, and the sooner we can get to the individuals at the youngest ages possible to try to intervene is key, as we know in many other diseases as well.
One more for you. Lori Anderson, I'm a guest. Dr. Mincy, when we rolled out the vaccine to our senior communities first, there were some challenges to register for that vaccine. And I was just wondering if your office has had a chance to look over that process to make it more easy for that community in case we have another event.
Great question. I received this the other day from a Rotary member at an event. But yes, so again, talking about partnerships, we take all the credit as a group and we take the opportunities for improvement as a group. So actually all of that went through County's 311 system call center. And we were on the fly, so we were having these discussions over the phone. Should we start with Eventbrite and just use our system that way? We learned a lot through the process, absolutely. Would we want to do it differently? We do after action reports, usually when a disaster's over, look at best practices, but also those opportunities and plan for the future. So yes. I will tell you though, being at an event the other night, and many people were talking about the retailers, and you can't just call and talk to somebody. You have to do it only through the computer, and a lot of people don't like that. So there are other options. Exactly. So I tell everyone, we still have the vaccines. Call us. We will schedule you an appointment at the health department. MCR Health still has many vaccines, your private providers. And nothing against the retailers. We appreciate it, but they're a different entity, and so they do things differently. But that now is becoming such a challenge for flu and COVID for our seniors who aren't used to utilizing that opportunity. Sure.
Thank you so much, and thank you, Dr. Benzie, for taking over my podium. I appreciate it. That's okay. Please give our panelists another round of applause. Dr. Benzie, Susie Bowie, Jackie Dalewski, and Megan Cassidy, we appreciate you. Listen, if you want to become a member, please see Tanya today. I'm going to say that again. We are starting our PAC Glass Leadership Foundation's Scholarship Awards. We will be giving our first scholarships out next year, and we will be partnering with Mary Glass to bring it through the Manatee Education Foundation to present these scholarships for any of our students that are in leadership in their schools, in high school, for a high school senior, for a female, and a male. And we are very excited about that. Nancy is going to be chairing that. If you want to just, that's Nancy. So we're going to tell you how you can give money, lots of money for our children. You will be hearing. But we are so excited to be doing that for next year. If you are interested in joining our board, I do have a couple openings in, but I need your resume like yesterday. But we will be looking for our members to join committees. We want to get you more involved. We want to get your say-so and your input in what we're going to be doing and all the information that we're going to be putting out for Manatee Tiger Bay. So we invite any of your corporate, nonprofit, individual members. You can go to Manatee Tiger Bay. And remember, bring a guest and then have them join too. Did I say that? All right. Thank you to Pier 22 for providing the complimentary valet parking and all of our servers. Thank you to all of our media, especially my Charles and METV and Chris and everybody else. Thank you so much for all you do. This is the end of our last meeting for 2021. We are going to start off a new year with the bang. And thank you so much. Again, I'm Xavier Bailey, your president. Please have a great day.